Chapter 4, From Cells to Organ Systems, Screencast 2. Now, what we just talked about in the previous screencast were tissues. So we're now moving on to these higher levels of organization. So now we're going to be looking at organs and organ systems. Organs are defined as two or more tissue types joined together that perform specific functions. Organ systems, now we're talking about groups of organs that perform a common function. Within the human body, we actually have 11 organ systems. Examples are going to be digestive system, made up of the mouth, throat, stomach, intestines. If I look at the lymphatic system, so lymph nodes, tonsils, and spleens. So these are kind of examples that you want to keep in mind. So you should be able to know what these systems are. So if we look at the integument, that's skin, skeletal system. So now we're looking at bony structure. Muscular system, so this is, sometimes you'll see musculoskeletal because the two really do work together. Nervous system and endocrine system, those are the two control systems within the body. One is going to be electrical control and the other is hormonal or chemical control. Then we've got the digestive system, and so on. So you should be able to give examples of those. Now, keep in mind these are anatomical systems. There is one system, the immune system, which is not really an anatomical system. It's a functional system, and that's because the immune system is actually made up of components of other organ systems, specifically the lymphatic system and also the circulatory system, so the blood component. So that's something to keep in mind also. Now, the other thing we want to kind of take a look at are some general terms. Now, where are we going to find these systems, okay, within our body? And so now we want to talk about body cavities. So language is going to be really important. And so the image on the right, as you're looking at the screen, that person is in what we refer to as standard anatomical position. So arms are out to the side, thumbs are facing outward. That is standard. So whenever we use the term right to left, it's always with regards to standard anatomical position. So if we look at the major cavities, I have an anterior cavity, so that's going to be on the front side, and I'm also going to have a posterior. Now within each of those, there's going to be subcavities. So if I look at the anterior cavity, that's going to be the thoracic. And within there, we're going to find subcavities. So two pleural cavities where the lungs are going to sit. The pericardial cavity, that's going to be where the heart is. And then I have the abdominal cavity. So you might also hear that sometimes as abdominal pelvic cavity. Now on the posterior side, we're going to have the cranial cavity, and that's where the brain is. And then we have the spinal cavity, and that's where the spinal cord will be traveling. So you want to be comfortable with what organs you would expect to find in those particular cavities, and so on. Now, there's going to be membranes that are actually lining the body cavities, and those are quite often referred to as serous membranes. Now, serous membranes are actually going to line and lubricate internal body cavities. And one of the things that they're going to do is actually reduce friction between organs. Kind of think of them as holding things in place. Quite often when we look at the serous membranes, we think of those within the abdominal cavity primarily. And kind of imagine if you were going for a run and you had nothing holding your organs in place and everything would just be sloshing around and you could feel that. That'd be kind of crazy. All right. Now we have mucous membranes. Now those are always going to be lining entryways to the body. So our airways, the digestive tract, reproductive tract, and they're actually acting as lubricative in nature, protective. And because it's mucus, it actually traps debris, okay? And so that's something that we'll see. Synovial membranes are limited to movable joints, okay? And then the biggest membrane is actually the cutaneous membrane, and that's the outer covering, so our skin. Now here, you also want to be comfortable with some of the terminology that's used. So this figure here is showing two things. On the first, we're looking at planes, And so we have three general body planes, and you want to know the directions or the regions that a plane is going to split the body into. So if I look at mid-sagittal, that's going to divide the body into left and right sides. If I look at the frontal plane, that divides the body into front and back. And the transverse plane is dividing the body into top and bottom. So you want to be comfortable with those terms, along with these. So these terms that are used to describe relative position. So anterior, so that's going to be at or near the front. Posterior, at or near the back. Proximal, closer to the body's trunk. Distal is further away. If we look at superior, that's situated above or directed upward. Inferior, situated below or directed downward.